This is Tom Bernanke. Today I'm talking about turmeric and curcumin. This is an all-natural supplement that can mimic a lot of what medications can do. We're talking about ibuprofen, NSAIDs, anti-inflammatory. Does it really help with pain relief? We're talking about the pros, the cons. What's the safe dosage? What do you have to be worried about? We're starting now. Turmeric is an all-natural spice. Taken 500 milligrams to 2,000 milligrams per day. It's eaten regularly in an Indian diet. It's usually safe and non-toxic. It's very well studied, and it's most famous as an anti-inflammatory, but it does a ton of other things. And some studies do show that it's more effective than anti-inflammatories like ibuprofen. But there are some side effects to be considered, and that's what we're going to go over in this video. If turmeric curcumin is worth it. So what's the difference between turmeric and curcumin? Turmeric refers to the root or the plant. It's not always pure. There are some oxalates in there. Curcumin, on the other hand, is the active ingredient found within it. Most of the new supplements are now 95+% concentrated curcumin, so you're not really taking the turmeric root anymore in the supplements. It's usually the curcumin. We're going to go over the big secrets on how to get the most bang for your buck from your turmeric, your curcumin. It helps with osteoarthritis, joint pain. There's huge benefits to taking it. One of the most popular supplements on the planet. There is a lot of complicated science behind how turmeric and curcumin works. It does so many different things. It inhibits necrosis factors, cytokines, COX-2, and lipooxygenase. It functions as an antioxidant. It can change cell growth and even cause apoptosis, so cell death of bad cells. So it's said to help with some cancers. Turmeric and curcumin is an all-natural supplement. It's eaten regularly as part of the diet in India. But does it give the benefits that people say they're getting? Do you get the joint relief, the pain relief, and who should watch out for it? We're going to first start by going over the 5 top benefits of turmeric and curcumin. Number 5, skin health. In a recent study in 2018 in the Journal of Cellular Physiology showed the potential of curcumin in treating skin diseases due to its anti-inflammatory, antimicrobial, antioxidant effect. It can help in conditions potentially like psoriasis, acne, aging. 2018, a review article was performed looking at 234 articles. They determined 18 were high level. 9 of the articles focused on the ingestion of turmeric, and 8 looked at topical cream application. 10 out of 18 of the studies showed significant improvement in skin inflammation and conditions. And these conditions that it was helpful for were found to be acne, alopecia, atopic dermatitis, that basically means itchy skin, photoaging, itchy skin, which is called pruritus, psoriasis it helped with, and vitiligo, which is basically patchy skin discoloration. Number 4, digestive health. A recent study in 2020 in the International Journal of Molecular Sciences showed that curcumin could potentially affect gut health. It can help alleviate symptoms of bloating, gas. This can be beneficial in inflammatory bowel diseases and gut health. There is a lot of studies about turmeric and gastrointestinal health. It can stimulate bile for better fat digestion. It can promote liver health. It inhibits stomach acid through limiting H. pylori, which is the bacteria. It can help liver health. So they've actually done a study that fatty liver disease can be improved. They've done a study on inflammation, inflammatory bowel syndrome. The study I showed earlier, it doesn't really change the microbacteria or the microbiome in the GI tract, but people clearly have much better symptoms. It's been shown to help with GI cancers, and it does help with indigestion. Number 3, cardiovascular health. In a recent 2019 study in the journal Nutrients highlighted that curcumin can help endothelial function, a key factor in cardiovascular health. This could potentially help with heart disease and improve vascular health. There are just so many studies on turmeric. That's the crazy part about it. It's so well studied and so well accepted to be safe and effective at this point. It does lower blood pressure in one study with better endothelial cell function. That's the cells in the blood vessels. It's been shown to decrease inflammation of the blood vessels, and because it's an antioxidant, it does reduce oxidative stress. It was actually effective in lowering LDL, which is considered to be the bad cholesterol, and it does increase the levels of HDL, which is considered to be the good cholesterol. In the Journal of Cellular Physiology, it did show in a study that it does prevent the rate of blood clots. Now, this isn't an extreme amount. Even when you take a daily baby aspirin, your rate doesn't go like 1,000 times less. It's really just like a 50% reduction, but there is an increased risk of bleeding if that's a concern, or if you're on other medications. Another beneficial study in the Diabetes Care Journal did show in numerous studies that people with turmeric intake did have decreased blood sugar compared to a control group. Number 2, brain health and mood regulation. A recent study in 2021 in the Journal of Psychiatry found that curcumin does show promise in treating symptoms of depression. This could potentially enhance mood and cognitive function. Although these are very difficult to study, people who take turmeric might be better protected for Parkinson's and Huntington's disease. Some studies have looked at this, and this is because there's less inflammation and less oxidative stress due to the antioxidant effect of turmeric. The Annals of Indian Neurology actually did a study that showed that curcumin could break up Alzheimer's plaques. There are other studies correlating this. Again, since this is such a progressive disease, it's hard to study this for sure. The Journal of Affective Disorders showed that curcumin has a very beneficial effect on depression. And the American Journal of Geriatric Psychiatry showed that due to its anti-blood clotting effect, it can be very beneficial in preventing stroke. But the number one function, it is and always will be the number one function of curcumin and turmeric, is anti-inflammatory pain relief. So joint pain, muscle pain, aches. In 2020, the Journal of Inflammation Research showed significant improvements in the symptoms of osteoarthritis with curcumin supplementation comparable to standard pain relief medications. Basically, you're talking about your anti-inflammatory medications. Taking curcumin and turmeric can help with that. It did help with conditions like joint pain, osteoarthritis, and muscle pain. These are individual studies. I know when I look at these, sometimes small journals like the Frontiers of Psychiatry might not be the best journal. What we want to look at is systemic reviews and meta-analyses that summarize lots of trials, especially randomized control trials that examine the benefits of turmeric, curcumin, and that's exactly what some of these studies do. This meta-analysis looked at 66 randomized control trials and found that turmeric and curcumin, and almost all of them, significantly reduces levels of inflammatory markers such as C-reactive protein, tumor necrosis alpha, interleukin-6. These are all inflammatory markers. They came down. Turmeric works on so many different pathways. It can inhibit tumor necrosis factor, cytokines, cyclooxygenase, which is implicated in inflammation, lipooxygenase. It neutralizes free radicals because it's an antioxidant, and it can modulate cell signaling. That's why it can help with some cell regulation and even cancers. Interleukin-6, tumor necrosis alpha, and CRP. It also showed improvement in antioxidant activity by enhancing the total antioxidant capacity and increasing superoxide dismutase activity. So decreased inflammation and increased superoxide dismutase, which helps stop antioxidant free radicals, which can damage chemistry, enzyme structure in the body. There are just so many studies for turmeric and joint inflammation. So the Biofactors Journal looked at all forms of chronic inflammatory disorders, so heart, bowels, joints. It helped everywhere. And more specifically, with joint inflammation, there are many studies showing that it is just as effective as some medications. Now, the goal of this channel is not to go down that rabbit hole because I could get in a lot of trouble, but take a look at some of these studies yourself in the Journal of Medicinal Food, the Journal of Clinical Immunology, the Phytotherapy Research Journal. There's just so many of these studies. There's so many high-level meta-analysis studies. There's double-blind clinical trials. Go take a look at some of them. Tell me what you think. Is this BS or is this just as effective and not really talked about? This is where I love YouTube because sometimes more people watch these videos than have been questioned in these studies. So tell me if this works for you compared to pills. I'd be very interested to know your answers. but it's not all perfect. There are side effects to curcumin and turmeric. Number one, gastrointestinal issues. High doses of turmeric can cause diarrhea, nausea. The Journal of Clinical Pharmacology in 2013 reported that the most common side effects are these stomach issues, diarrhea, stomach issues if you take too much. High doses, we're talking like 1,000 milligrams over 500 milligrams, can cause diarrhea, nausea, stomach upset. This is documented in the Journal of Clinical Pharmacology in 2013. These are high dose side effects. I think with reasonable doses, a little bit less concern, like 60 to 100 milligrams, like adding it to a dish, that might not be a huge concern. But when you're taking these super supplements that are like 1,000 milligrams with supercharged additives, that might cause some issues. But number two, it can increase the risk of bleeding. Turmeric can thin the blood, so similar to aspirin. In a 2012 study in the Journal of Surgery, this highlighted the need for caution with patients on blood thinner. If you're on blood thinners already, maybe think twice about taking turmeric.
Curcumin works at various stages of the blood clotting cascade. It stops the clot from forming and stops certain clotting factors from working. It reduces chronic inflammation. This is considered a good thing in a lot of people. It's an anticoagulant, but if you take too much or if you're on other blood thinners, it could increase your risk of bleeding, especially if you're going for surgery.
Number three, it can lower blood sugar too much. In diabetic patients, high doses of turmeric can excessively lower blood sugar levels. So too much of a good thing could actually become a bad thing. A study in the Evidence-Based Complementary and Alternative Medicine Journal, I know, not the best one, in 2013 showed that it could potentially cause hypoglycemia, so too low.
Curcumin really helps with diabetes. It's said to be an antioxidant, help inflammation, thus improving insulin sensitivity, beta cell function, and actually helps store sugar in the liver.
Here's a big one that I see mentioned in the comments of videos quite a bit: iron absorption. Turmeric can interfere with iron absorption. In the Journal of Medicinal Food in 2019, it showed that iron deficiency can be made worse by taking too much turmeric.
A famous side effect of high-dose curcumin is that it can bind to iron in your gut. So anemia is when you don't have enough red blood cells to carry your oxygen. You feel tired, you feel fatigued, and what happens is when you eat turmeric, which has curcumin in it, it can bind to iron. And when it binds to that iron, it does not cross your stomach lining, and thus your body can't create red blood cells, which require iron to bind that oxygen. So as a result, you're tired, you're sleepy, and it can also interact with medications that can cause this problem as well.
Kidney stones. High consumption of turmeric can increase the risk of kidney stones. This was in a 2008 study in the American Journal of Clinical Nutrition. This is because of oxalate levels. Now, where this is popular is the plant paradox. Dr. Stephen Gundry talks about oxalates a lot. You know, I see this debated quite a bit. Maybe the studies aren't as strong as Dr. Gundry says. Tell me what you think in the comments. Have you read the plant paradox? Yay or nay? Personally, I was kind of blown away by this book, so I looked at all the studies, but they're just not very convincing. Look at the studies in oxalates. Are they very strong? But anyway, here, turmeric can cause kidney stones.
Curcumin is actually very healthy for the kidneys as an antioxidant and as an anti-inflammatory, but turmeric root itself is not pure of curcumin, and it does contain oxalates. And too much of these without hydration can affect people who are susceptible to kidney stones and create further kidney stones.
Allergic reactions. Some people, like with anything, people can have allergies. There was a study in the Journal of Contact Dermatitis in 2009 showing some people are allergic to turmeric. You could have skin reactions. And of course, high doses cause diarrhea, nausea, upset stomach, but these are the most common. So the stomach issues are the most common. Are these side effects something to worry about? These side effects are all generally associated with high doses. If you're on blood thinners, if you're taking warfarin, for example, you might want to be careful for too much blood thinning. Check your levels with your doctor. But for most people, turmeric in culinary, that means adding spice to your food amounts, is considered to be very safe. A large portion of the country eats these regularly. Most don't have issues. However, if you have diabetes, blood disorders, kidney disease, kidney stones, you always have to double check things. If you're having symptoms, it might be a good idea to start low. If you're not having symptoms, maybe take the regular dosage. But if you start low and you're not feeling good, you're numb, you're tingling, you're not feeling good, then don't take any more. Dosage. How much curcumin and turmeric should you take? The standard recommended dosage is about 60 to 100 milligrams per day. This is the common amount in a common Indian cuisine. It's considered to be very safe. Most people can tolerate this. As a supplement though, some people do take 400 to 600 milligrams of curcumin 3 times per day. The way I think about this is no supplement is as safe as just eating a good strong diet, exercising, sleeping well, getting your cardio in. But for example, if you're already taking anti-inflammatories, ibuprofen 2, 3, 4 times a day, potentially this might be another option to consider. For dosages like this, you have to see how you adjust. The Journal of Alternative and Complementary Medicine in 2016 used 1,000 milligrams per day for osteoarthritis treatment. They saw good results, low side effects, but not everybody can tolerate this amount well.
Out of the 66 studies that I mentioned, usually about 500 milligrams were used, but some of them used 1,000 or 2,000 milligrams per day, broken up into doses. When you get to the higher end, you tend to have more side effects. On the lower end, there's very little side effects. It's well studied. It's well proven as an anti-inflammatory. There's a lot of studies showing that it's just as effective as some anti-inflammatory pills, but too much can cause iron deficiency, anemia, and some bleeding risk.
What are the best supplements for turmeric? One form is standardized curcumin extracts. These extracts contain higher concentrations of curcumin compared to regular turmeric powder. These are about 95% curcuminoids, the active compound. There are enhanced absorption formulas. These formulas are meant to increase absorption. For example, these include black pepper extract, liposomes, nanoparticles, phospholipid complexes. A study showed that combining black pepper with curcumin increased bioavailability 2,000 times. Most supplements that I see now have black pepper or piperidine combined with the turmeric and curcumin. Essentially, most supplements now have the concentrated 95% form of curcumin found in turmeric, so it's the concentrated form, and they include the black pepper extract. Another form is turmeric with fatty acid components. Curcumin is fat soluble. That means fish oils, flaxseed oils, eating with a fatty meal might be a better time to absorb it. Don't eat it on an empty stomach, eat it with a meal. And make sure you have third-party testing and quality assurances. The thing with vitamins is not everything's double checked, but there's a lot of good manufacturers now that are improving their quality levels. Here's the best tips for your turmeric curcumin. Number 5. Regular intake for chronic conditions. If you have osteoarthritis, if you're managing rheumatoid arthritis, for example, a study in 2016 showed consistent consumption led to better symptoms, less inflammation, but you have to be careful too. Too much of a good thing might cause some side effects, so you have to be aware. Number 4, avoid excessive doses. 99% of people are fine, except for potentially upset stomach, nausea, but the European Journal of Pharmacology suggested that people with the higher amounts, so taken much more than recommended, the 400, the 600 milligrams, that's who had the side effects. Stick to the recommended dosages. Even 60 to 100 milligrams in the diet might be good enough. Number 3, always check with your doctor. I always tell people, start slow. Start that small amount, maybe 60 to 100 milligrams. If you're on blood thinners, if you're diabetic, if you're having abnormal issues, discontinue it, try something else. Not everything's for everybody, but check with your doctor. I know that gets a lot of hate in the comments. It's true. If you're having adverse effects, let your doctor know. Number 2, consume with fats. Curcumin is fat soluble. Eating it with a meal gets better results. Black pepper gets a lot better results. Eat it with healthy dishes, olive oil, avocados, some meat. That's a great option. And number 1, I mentioned this, black pepper extract. Piperine in black pepper enhances curcumin absorption significantly, 2,000 times. So that study in 1998 showed 2,000 times absorption. If that helped, check out my other supplement videos and the top 10 people who should avoid taking curcumin and turmeric. Check that out below.